Well, hi there, everyone. This is Dr. Shoto with this week's video introduction to week number 2 of our course in the Principles of Healthcare Research. I'm off to a pretty good start this week. Really, this first week of class is primarily us getting to know each other a little bit and you sharing a little bit about yourself in the student lounge. And so I think I got to everybody and was able to read everybody's bios and find out a little bit about what your interests are. And we got a really good smattering of experience and students in the class. So that's always really good news. The major topic of focus this week in the classroom itself was talking about this difference between qualitative and quantitative methodologies. And to tackle that question and to use that as a way of examining what these things mean, you were given two articles to review. Let's see, we'll start with the Beck. The Beck article was the qualitative study that was done on women who had reported that they had post-traumatic stress disorder as a result of childbirth. And Beck's really her primary goal in that particular study was really just to find out, what are these women living with? What are their symptoms like? How does this condition impact their lives? It was qualitative because it really wasn't trying to answer any big questions other than just let's find out more about what is the life of these women really like. And so you'll notice that in reading the study, it's a little bit less structured. It doesn't have the same sort of structured and that same deductive structuring style. It's very open-ended, and everything is really very open-ended. And Beck identifies themes that these women express, and that's really what the goal of qualitative research is all about. And then the Kolkaba study, Kolkaba et al. Study, is a very straightforward quantitative methodology where Kolkaba wanted to see, does hand massage, and a very specific type or style of hand massage, result in increased comfort in patients who are undergoing hospice treatment and who are at the end of their lives. And so we had a really good discussion about both of these topics in class. I think that probably the majority of comments came back about the Kolkaba study, and several of you had pointed out that this really would have been better done as a qualitative study because it seems like a very qualitative subject. We're talking about comfort, and particularly in hospice patients, and many of you wanted to really kind of sort of delve into and say, we really want to know what's going on with these patients. And what makes it a quantitative study, not qualitative, is not that it's about comfort care or anything like that. It's because it is it's asking a question. The research question is, does hand massage result in increased comfort in these patients? It's a straightforward quantitative question. The only way to really answer that question is to set up your variables, and the dependent variables were set up. The patients that would have received hand massage and the different types of hand massage, those are the independent variables. And then the dependent variables was the outcome measures that were used a comfort level scale. Comfort is something that is difficult to measure and difficult to quantify. And so that is a challenge that all researchers have. Anytime, especially that we're talking about anything that is subjective, whether we're talking about people that are having stress is something we can measure quantitatively, even though it is really a very subjective experience. Pain, anxiety, these are all things that sometimes we have to measure them indirectly or measure them using some sort of a scale to kind of come up with this numerical rating system. And so that's why that particular study was done as a quantitative study. And several of you posed, and it's a good question, is that this really would have been done, or why didn't they use a mixed methodology study? Mixed methodology is where you're doing both qualitative and quantitative at the same time. And there's really a couple very easy answers for that. One, because even if you had received or had collected any qualitative data, in other words, any data about what the families were going through or how the patients felt about the therapy or the therapist or any of those things, it didn't help to answer the research question. That information would not lead you to any better answer the question, does hand massage lead to increased comfort in these patients? And that was really the focus of the study here. In order to do it as a mixed method study, you'd have to change the question to incorporate that wanting to understand more about these patients' lives. But that would also do two things. One, it would be a lot more burden for the patients. And reading through the studies, these patients were very burdened. It was hard to get patients for this study. So it would have burdened the patients more, and also would have taken a lot more time and resources. And analogies like this, I gave one analogy, I think, uh, in response to, I think it was Shalani in class, if I'm not mistaken. But, an analogy would be like this. Let's say, for example, that a patient comes into a outpatient clinic and they have symptoms of a UTI. And so we want to know, do they have a urinary tract infection or not? Well, all we really need to do is just do one simple test. That simple test, just have them do a urinalysis. A urinalysis will tell them fairly definitively whether they have a UTI or not. Now, that's not going to give us the whole picture. It's just basically answering a yes/no question. But until we know that they have a UTI, we really don't have to go through and do a complete blood count and uh, do any sort of other diagnostic tests or a thorough workup, because it's not going to help answer that question any better. The question is answered with just the data that we're seeking to receive. And so that's a little bit of an example, or that is, it's not a perfect analogy, but that's kind of highlights a little bit about, maybe explain a little bit about why these researchers decided to just stick with, just answer the question, does hand massage result in improved comfort? Because that would have pretty big ramifications if we can come up with a very simple, easily applied type of a intervention like that. If we showed that there was a statistical difference in those patients, that could be pretty significant. That could be new evidence-based practice, and that was the focus of the study. We'll be talking about these concepts more as we go through class. This isn't the only time that we're going to talk about qualitative versus quantitative. And in fact, we'll actually be reviewing these same articles again in future classes. But overall, really good discussion this week. In week number 2, we're going to be talking about the different types of literature, the differences between primary sourced and secondary sources of literature, where to find that type of literature, and concepts about why that is important. And then you're going to take a stab at writing a research question, and then to describe what methodology you would use for that research question. And again, the basic rule is this, or the basic thing that you want to look at is this. In a qualitative question, you're going to be asking about anytime that you want to know more about something. You want to know about the patient's values, attitudes, and beliefs about a particular phenomenon. A quantitative question is anytime you want to know what is the effect of something. What is the most effective treatment? What is the most effective intervention? What effect does one thing have on another? That is going to mean that it's going to be a quantitative research question, or a research question that's going to be answered using quantitative methodology. It's not the topic or the subject, it is that what is the research question? That's what it all boils down to. So I will look forward to participating with you in class once again. Look for your grades to be posted sometime, I'm guessing probably midweek. Of course, really just the discussion question grading this week. And as you have any questions, let me know, and I look forward to seeing you in the discussion forums.